Well, our next guest is Chris Hwang. Chris is currently Vice President at Transcenta. And hopefully he's coming up here. Hey, good morning, Chris.
Thanks for
John.
joining us. Chris, actually, we first met when you were Vice President at Genzyme, if I remember rightly. That seems like a long time ago. And again, we're still very young, as I explained in the previous section. But Genzyme's fascinating because I think it was the first company to so very publicly state the direction and the thought process about going continuous. And in those first few processes, of course, you were, I think it's relatively public, these are perfusion processes that needed updating. So, the perfusion decision being made, but you took it further than that. You took it and said, we're gonna integrate extra pieces here. So can you talk about your thought process right from the beginning about why did you decide to take those extra steps and what was important to you as you debated that internally?
Yeah, so, early on, I said back in 2009 or so, I think we already had, I would say specifically Constantine, which you also know, had this vision of continuous process, looking at how other industries has gone from batch to continuous with all the advantages. So there was certainly a vision of going to continuous. For us, because our upstream process, which is already perfusion, and since we adopted ATF, which you were very intimately involved, the fact that the clarified harvest fluid coming out of reactor already, and the fact that we are already looking at some sort of continuous chromatography system in our downstream group, it became very obvious that we can connect the two together to really gain a lot of the benefit in terms of removing all the clarification step and then also the large storage tank for us to really make the process much more streamlined and economical. So that was really sort of the genesis of implementing a continuous chromatography system in terms of capture to our perfusion process. And that was really important for us because it really simplified the operation quite significantly. Yeah.
And I mean, at the time, equipment didn't really exist, right, to do that integrated capture, or at least not in our industry. There's of course continuous downstream in the food industry and various other places. But so that was quite a risk that you had to invent a unit operation. And how did you think about that risk and the eventual outcome? And did you feel justified at the end of it? Was the risk worth taking?
So we were taking a lot of risks, not just on the downstream, but upstream too. But on the downstream side, yeah, we were fortunate to have very innovative downstream teams that was already working on aspects of continuous chromatography. I remember, our downstream team, they were using their active system in the lab and putting together these columns to try to simulate sort of continuous chromatography system, multi-column systems. So they did a lot of lab work to demonstrate that it works. So we generate a lot of data to support that this technology can be very robust. Certainly focusing on process understanding and also equipment understanding, and partnered with someone like GE at the time, who was one of the industry leaders in developing these bioprocessing equipment automation to make these things become sort of implementable in the pilot and GMP environment. So, from that perspective, and also just like any, innovation, there's a lot of risk involved. So we take risk management very seriously. We not just generating very good data, but we do a lot of the FMEA analysis to ensure that we have mitigated all the high risks in implementing something new like this. And then we basically get the unit in from GE. We connect it with our single-use bioreactor. We've done multiple runs to demonstrate that the system worked as intended. And certainly our team worked really hard on that. And then generate a lot of very useful data that we actually approach FDA and EMA on an ETT team, and ITF and EMA, to get their support and their feedback. So a combination of these internal and external validation, it gets us to the point there where we feel that we have the information we need to move forward. And given all the advantages that I already talked about for continuous, it was it then becomes fairly obvious that we can convince our management to move forward with this technology.
And I think it's interesting what you point out. You actually engaged with the regulatory authorities as you went down that process. So that was one element of mitigating that risk, that you weren't going out too much on a limb, that you understood the data that was going to be required to validate the process and,
right.
and get a resource. So in the end, I mean, the facility obviously got built. I guess the experience was very valuable, and I guess now Sanofi and Genzyme Clinical bought by Sanofi, that's deemed a success. Is that correct, or was there? I think maybe you left before that happened. I can't remember the timing. What's your recollection?
So it was highly successful. I mean, just imagine that if you can replace your 4 by 2,000 liter stainless steel perfusion bioreactors with 1 or 2 50-liter single-use bioreactor with about, I would say, 2 orders of magnitude smaller column compared to your original commercial scale for capture, where the whole system is fully automated. Just to give you a sense, that's really, it's a successful outcome. And the success is really measured by one, convincing management to move forward, which was a daunting task. But also, more importantly, is to get regulatory approval for these type of technologies. And then there are more coming. My understanding from my colleagues in Sanofi, they continue to work on other products as well. And then now they're using this platform for all future products. So to me, that's what success looks like. Is really to develop the technology and implement it so that eventually we can benefit the patients.
Fantastic. And of course, then you've moved on to Transcenta, and now you're at Transcenta, and there, you had a whole set of new molecules and processes you went in. So you were kind of a little bit more free to do what you wanted to do. And if I understand correctly, you've taken a series of extra steps on that continuous line. Where are you in Transcenta on the terms of what does fully continuous mean, and why have you made those decisions?
So the situation in China is very different. And just talk a little bit about the driver to do this. There was significant drug pricing pressure in China. So any drug that comes to China, typically the drug prices will drop at least 50%. And even the domestic products is highly competitive. So for you to list your drug in the national reimbursement list, you require significant reduction of your drug price. So consequently, low cost of goods is not only a competitive advantage for us, but in many cases, it's a go or no go decision for us. So in order for you to get the low cost of goods, that's where process intensification really becomes important. And we chose a continuous or a version of continuous process to get us there. So that was really, really critical for us to get there. So where we are is we put together a 5-year plan to go developing a highly intensified perfusion process. We chose a continuous perfusion steady state process that Simon just talked about. And then integrated with a capture technology, and then followed by a flow-through polishing system that we're collaborating with Millipore Sigma. But the whole process is not end-to-end. And the reason why we decided to not go end-to-end is that because our facility has a relatively small footprint, and we don't want to tie down these new technology equipment to one product at a time. We wanted to be able to process multiple reactors and use these technology to debottleneck our facility. So we ended up not doing end-to-end, but certainly, there's a slide later I can show you what's sort of our platform moving forward. But we decided to do sort of this hybrid continuous to really allow us to maximize the output from this a very highly flexible and small facility that we have built.
So I think it's fascinating. You went straight to the cost. You went straight to saying, you had to evaluate each operation, say which bit will continue, which one won't. The flexibility is, if I heard correctly, that's what you were also saying you had to take into account. But you don't have that many, you're not a huge pharmaceutical company with a huge portfolio. So is there a risk that wouldn't it just been quicker and easier in batch, right? Wouldn't you have got to maybe phase 1 trials fast without this investment? I think a lot of people feel that there's an investment which is almost for the ideological state, and maybe when you go continuous, that's later. Can you talk to that? Why is it true from your view that the continuous is right from the beginning, even as you develop the process preclinical?
Well, when I say continuous, I don't mean that we go all in in even our early stage programs. Our goal is that at the end, when you're in the PPQ and commercial manufacturing stage, that the platform that you use is what we envision this integrated continuous process will look like. So that our end goal is to get there. But how we get there, we don't go all in from the very beginning, because we're still developing the technology to ensure that it's mature and ready to be implemented. So we do it incrementally to manage risks. So for instance, in the beginning, we may start with perfusion, but our downstream be batch. Or even when the platform's not ready, in the beginning, we were still fed batch. Once a perfusion is ready, then we will convert to perfusion, which we've done recently for one of our molecules, and we've gotten regulatory agency approval to switch to the perfusion, just based on our comparability data package. But then we implement as the technology is ready into this process. So we rely on process changes during the product development to ensure that your final end goal, your end process is where we want it to be. And so that's really, sort of our philosophy is we don't want to risk our programs, but we want to find ways to de-risk, but still keeping our end goal in mind in terms of where we want it to be.
Right. And so when you to focus in on those early stages, I think people have in their minds, fed batch, maybe it's a 2-week process. You move that into perfusion, you said, kind of as quickly as you can. And then people go, that might be a month or 2 months. So surely you've just doubled or tripled your process development time. And of course, behind that is an assumption that, one run is one batch, and that's obviously not true. You split up the runs. But then how do you avoid extending that time? Is there an extension of time, but it's worthwhile? Or in fact, again, is that a misplaced way of how you develop a lengthy perfusion process?
Right. So a very important criteria for us is that by developing this new platform, it doesn't impact our timeline. In fact, because we developed the perfusion as a platform, to use that example, is a plug and play platform, so that typically we run our phase 1 process no more than 20 days, 21 days. But because it's plug and play, there's no development when we go to phase 1. So you plug in your cell line, you run it for the duration that you desire. So we typically can achieve, I would say, from top clones to the process lock in less than 10 weeks, which is very, very fast. So typically our timeline from CNC package to IND is still approximately 10 months. So it hasn't really slowed us down. In fact, I think it may accelerate a little bit in terms of our time to clinic. So from that standpoint, we don't think, PD would extend the timeline. Certainly there's more work to be done later on in the process, but again, that's not going to become rate limiting, right? Rate limiting is really around your clinical. So we don't see how implementing continuous technology is going to negatively impact the timeline.
So it's fascinating to hear. And I know, so in Transcenta, you had this 5-year plan. I think you're partway through it now. How are you delivering against that plan? Is that delivering what you expected, or how is that? It's always nice to have a vision, but executing on the vision is the hard part, right? How is it going?
Right. Yeah, so we started this 5-year plan, I would say, in 2018 when our facilities opened in Hangzhou, China. And, so I would say we're getting close to being done. So 2023 would be 5 years. It's certainly the COVID has delayed the overall time by 6 months, but we're very much well into it. In fact, Adrian, do you mind showing the slide, one slide that I put together? Right. So if you take a look at this is where we almost there, that we will be there next year. Right. So this is the platform that we're building towards. First of all, before I go now, just want a big shout out to our CNC team at HJB, which is a subsidiary of Transcenta that is responsible for all the CNC activities, including the platform development, all the work that I'm going to talk about. And also they are providing quite a bit of full CDMO services. So all the work that's done is done by this team. So we really started off in this 5-year plan by building the foundation for the perfusion. We had to build everything from scratch, from cell line, how we select the cell line, the media, and then the perfusion platform. But within about a year and a half or so, we completed development of this platform, and we are now applying to every single one of our internal products. At the same time, we're also partnering with Millipore Sigma to develop this integrated, fully automated flow-through polishing system that combines 4-unit operation to 1. So really decreases the cycle time of downstream processing, including the engine and the multi-column chromatography system that we'll implement as well. So this platform is almost ready. So the combo system is currently in-house in Hangzhou. Unfortunately, I can't share a lot of information, but I will soon in the future. This system will be fully ready for GMP operations and very soon this year. And then the MCC will be later in the year. Our goal is to have the system all ready to go for PPQ, the PPQ run in Q1 23.
Right. And it's fascinating here. So you've got, some smaller bioreactors, some larger bioreactors feeding into this same pod downstream, or two pods, right?
Right.
How does that, I mean, you spoke originally of the flexibility. So that's 4 times the volume coming through. How do you match that up?
Right. So because we decided not to do end-to-end, so there need to be a whole point. But the whole point in this case would be Pro A. From our experience in Pro A is fairly stable. Volume is not unmanageable. But what this allows us is that for any product going through, whether it's fed batch, intensified fed batch, or in this case, continuous perfusion, we can quickly run through this pre-viral downstream pod, process the material in very, very short amount of time, right? And then you follow by the post-viral pod. So I guess the other reason we didn't do it fully continuous is that we also don't want to tie up not just the pre-viral pod technology, but also the post-viral pod, right? So if you have a continuous, that means you need to have a dedicated post-viral suite for each product, which we don't want to do. And for a small footprint, that we don't want to do that. So that's how we process everything up to Pro A, and then we process through the pre-viral pod very quickly. So from typically 4 days of operation or 5 days of operation, we can make it in 1 or 2 days, very, very fast. And that allows us to handle everything that's coming from our upstream process. Right.
So I guess there's 2 points I want to kind of finish on, which are both technical, if that's all right to dive in. Is Simon was talking about your development system being the same size as the manufacturing scale system, which allows you high confidence in that tech transfer and a large elimination of risk and time as you do that. Is that your experience too? That's how you run it in the development scale?
So. It depends on how intensify your processes. And from our standpoint, our lab scales are typically benchtop lab scales. So they're typically 2 liters or so. But when we go to pilot, or in this case, phase 1 manufacturing commercial, typically the scale will be much larger. So I would say from going from phase 1 process to commercial, there's little or none scale up, which is correct. But you still have to do the obviously scale from the benchtop. But overall, I think the risk is significantly lower because your phase 1 process scale and your commercial scale are equal or only slightly larger. So the risk is significantly reduced. Yeah.
Do you, in your portfolio of products, you've got what I would call quite a sophisticated large perfusion facility, but you've got maybe a smaller number of products compared to large pharma. How do you balance that capacity? Is it case if you were advising somebody else, who's got a small number, a biotech company, what is the right size for people to enter when you're not got such a large portfolio of products to produce? Isn't there a risk you've overinvested?
Yeah. So our facility design, well, first of all, our facility is not large. It's about 2,000 square meter footprint. So it's not very large. And our facility is built not at full capacity up front. I mean, we're specifically designed so that our processes are that our capacity can expand over time. So you don't have to build full capacity up front. But with increasing demand, whether at least for us, because we have a number of internal products that we're developing as well as for CDMO production, then we will increase our capacity as needed to meet the demand. So that's really our philosophy, is that you don't have to, that's why these type of facilities have become very important. You need to be flexible, not just supporting different type of molecules, but also you can build very quickly and expand the capacity as needed to mitigate sort of the capacity risk.
Well, thank you, Chris. It's fantastic talking with you. I think there's one or two questions. Please, let's take those at the end of the networking session. Chris will be available. And with that, I'm going to move on to Andy. So thank you very much, Chris, for your time.
Thanks, John.